A very good evening, everyone. It is my pleasure to welcome you all to the webinar on recent updates in maternal, infant, young child, and adolescent nutrition, hosted by the Department of Community and Family Medicine, AIIMS Patna, in collaboration with the Indian Institute of Public Health, Delhi, and Alive and Thrive. Myself, Dr. Venkatesh Karthikeyan, Community and Family Medicine Postgraduate Resident from AIIMS Patna, and I'll be the moderator for today's event. I'm thrilled to see such a fantastic response to this webinar with over 2,000 participants registered from different corners of the country. This turnout is a testament to the importance of the topic and need for more discussions on maternal, infant, young child, and adolescent nutrition. We have a fantastic speaker who will share her knowledge and insights on the recent advances in maternal, infant, young child, and adolescent nutrition. I extend my sincere thanks to Professor Dr. C.M. Singh Sir, Head of the Department of Community and Family Medicine and the Medical Superintendent of AIIMS Patna. Sir has always been our constant support and motivation for us to take these kinds of initiatives. I request Dr. C.M. Singh Sir to kindly share a few words with us. Sir, kindly unmute yourself, sir.
Okay, thank you, Venkatesh. I think at this moment of time, very few people have joined us. Should we wait?
No, sir, actually, only the panelists and speakers are in Zoom platform. The participants are in a different platform. Sir.
Okay. Then thank you. Thank you for inviting me to address this August audience. And I know Dr. Sevanti is with us. So Dr. Sevanti, Dr. Pragya, Dr. Samsad, and all the participants, delegates, and students, a very good afternoon, good evening to all of you. Basically, it gives me immense pleasure to extend a warm welcome to each one of you to this webinar on recent advances in maternal, infant, young child, and adolescent nutrition. This webinar is basically in collaboration with Department of Community and Family Medicine, AIIMS Patna, in Indian Institute of Public Health, Delhi, and Alive and Thrive. I am glad to know that more than 2,000 participants have been registered and will be participating in this event. As per malnutrition is concerned, we know nutrition is crucial aspect of health, especially during the early years of life. It is the fundamental building block for the growth and development of individuals, and it is of greater significance for physical and mental well-being of mother, infant, and young children and adolescent also. If we see, if we track the NFHS, which held in 2006, and result of NFHS which held in 2016, there is decline in undernutrition. We can see that there is decline in undernutrition, and this is very encouraging to all of us to know. But same time, if we see the overnutrition or overweight and obesity, the prevalence of over and obesity has been increased tremendously, more than 2 times actually. So at this moment of time, what I want to say is that India is facing the double burden of malnutrition. One side, there is the problem of undernutrition, and on another side, there is the problem of overweight and obesity. And we know the consequences of both. The consequences of undernutrition are very severe, and we know about that. And consequences of overweight is also overwhelming our health system and contributing the mortality and morbidity of India at present. So I know with this background, I know with us a very good speaker, a subject expert, Dr. Pragya Kumar, she is additional professor in Department of Community Medicine, Dr. Samsad Ahmed, who is associate professor of Department of Community Medicine, and both are very well trained, very good speaker, very good teacher of the subjects. And with us also Dr. Sevanti Ghosh is there. She has a huge experience basically in dealing with nutrition. So she has a huge experience. She will be sharing with all of you. With all these words, I would like to thanks to all of you to be in this, to attending this webinar, and congratulate you. And I'm confident that speaker will impart the sufficient knowledge on the problem of nutrition, undernutrition, and overnutrition both. So with this, I again welcome you all, and I am sure the learning will be of immense help in your future career and future development. Thank you, and all.
Thank you so much, sir, for your gracious presence amidst your extremely busy schedule. Now, I'd like to welcome Dr. Pragya Kumar ma'am, Additional Professor, the Department of Community and Family Medicine, and the Registrar of AIIMS Patna. Being a nodal in charge of MIYCAN project, ma'am has envisioned this webinar with the intent of knowledge dissemination about this crucial topic. I request ma'am to kindly share the welcome address.
Okay, thank you, Venkatesh, and a very good evening to all of you, Professor C.M. Singh, Dr. Sebanti Ghosh, Novina, Praveen, Anupam. I can see all the team Alive and Thrive team here, and I should congratulate all of you, like IIPH, Alive and Thrive, and AIIMS Patna too, for hosting such a nice e-learning course, and that is the need of the hour. As Dr. C.M. Singh has already emphasized on the burden of overnutrition as well as undernutrition, I hope this course will prove to be a very utility to all the learners who have been registered here. And I would encourage all the learners to please kindly enroll yourself for this course to get the maximum benefit. That's all. And congratulations to all the stakeholders who have been a part of this e-learning course. Thank you so much.
Thank you so much, ma'am, for sparing your precious time in organizing this event. Now, I'd like to welcome Dr. Anupam Srivastava, ma'am, from Alive and Thrive to kindly share the opening remarks.
Thank you, Dr. Venkatesh. At first, I would like to thank AIIMS team and especially the Department of Community and Family Medicine, and especially to Dr. Venkatesh. The main purpose of today's webinar has two goals. One is that we will be getting contemporary information on nutrition, which is directly related to health. Earlier, we were thinking that nutrition and health are two different components, but it is not. And now the trend is changing, and we are going to see how the nutrition is influencing health also. It's a kind of an integral part of health. So Dr. Sebanti is there. She will take us through the recent information and recent update on maternal, infant, young child, and adolescent health. And second is that we need, being a medical professional, we need to keep ourselves, our knowledge updated. And for that, EMIYCN course is there. And a kind of a small brief orientation will be done today. And if anyone is interested to get enrolled, that the process will also be discussed. And towards the end, there will be a kind of a question answer session when those person who is having any query can contact Dr. Venkatesh and us anytime. But today we have this opportunity to get the queries solved also. So I will not take much time because it's a very small time duration program, and we want to get the benefit from our experts. Dr. Sebanti is there. So thank you so much again. And one thing I would like to kind of a demand here, that this particular collaboration should kind of continue. Although we are continue working, and we are very kind of fortunate to have a very good professional relationship with AIIMS Patna. And with this particular thing, we will be more kind of improving it. So thank you, AIIMS team, and thank you, Dr. Venkatesh.
Thank you, ma'am. Thanks a lot, ma'am. So without further delay, let us get into the core content of today's webinar. I would like to request Dr. Atira Pratapan to please introduce the speaker, Dr. Sebanti Ghosh.
Thank you, sir. So I'm very much honored to introduce such an eminent personality to the session. Dr. Sebanti Ghosh, she is a medical graduate with specialization in preventive and social medicine and health systems and policy. Currently, she is a regional technical advisor with Alive and Thrive India, and is also a public health and nutrition expert. And she has been working for over 20 years in the domain of maternal, newborn, child, and adolescent health and nutrition programming and policy support across India and South Asian countries. So she is a member of number of technical expert committees on maternal, newborn, and child health and nutrition at national level. She has multiple presentations and publications to her credit in international conferences and journals. So we are very much honored to have you in the session, ma'am. Over to you, ma'am.
Thank you for the very kind words of introduction. And at the onset, I would like to congratulate AIIMS Community and Family Medicine team for organizing this event. And I really would like to thank Professor CM Singh, Dr. Pragya, and the team of Dr. Venkatesh and other younger doctors from the department who are taking this initiative forward. And it's a pleasure for us on behalf of Alive and Thrive to have such a meaningful partnership ongoing with AIIMS Patna. And I really appreciate the people who have joined this. It's so encouraging. And as the context was being said by the earlier speakers, I would like to share that I was requested to talk about some of the very recent advances in maternal, infant, and young child nutrition. But considering the time that we have for this session, I would be focusing more today on a few specific components of maternal, infant, and young child nutrition. Like I would be talking about breastfeeding, because the Lancet 2023 series have come out very recently. And I would also talk about a very different approach towards child feeding by looking at child food poverty. The time doesn't allow me to go beyond these two topics. And then, as Anupam, my colleague, mentioned, we will also talk to you about the e-learning course. And I'm very grateful to the way Dr. Pragya introduced it. I think the kind of continued medical education webinars like this one, and also the e-learning course, they all have the potential for keeping us updated. You know, as advances are made in the scientific domain, in the programmatic domain, and it's a good way for all of us to be interacting and having this mutual exchange of knowledge. So I'll request my colleague Navina to share the screen as I start the presentation. And I know it's a diverse audience today, and I hope I'll be able to meet your expectations. Navina, can you make it full screen? Yes.
Yeah. Thanks.
I think it's not yet full screen.
It's loading, ma'am.
Okay. So as the thing gets started, I'll start talking about, you know, the importance of maternal, infant, and young child nutrition in general. Already Dr. Professor CM Singh had set the context. We all know that while we are improving, we still have a persistent burden of malnutrition, which encompasses undernutrition, overnutrition, and also micronutrient related undernutrition. And we know that malnutrition is critical when we talk about improvements in health outcomes, whether it is morbidity related or mortality related, and not just survival. It looks at well-being and lays the foundation stone for ensuring human development happening to its fullest potential. Navina, the screen isn't moving.
Can you see?
I can see, but it's stuck, the introductory slide, and not full screen.
Okay, let me reload it. Just give me a moment.
So I'm continuing the discussion with you as the slides come up. So while we talk about, addressing nutrition, I think the investment that happens, it's moved to the next slide, but it's not yet full screen, Navina.
Okay. Is it now?
Not yet for me. Others can comment, Dr. Venkatesh, Anupam. Is it full
Yes,
screen?
ma'am, it is not full screen, ma'am. Ma'am, you please stop sharing. I'll share from my end.
Oh, okay. Thank you.
So I'm continuing the conversation, Dr. Venkatesh, just to be, utilizing the time. Oh,
Yes,
there it is. Thank you. It's full screen. Can you move
yes,
to the next slide?
yes, ma'am.
So as I said, why do we need to look at malnutrition across the continuum, undernutrition, overnutrition, and micronutrient related deficiencies? But we must be very much aware of the fact that while we are addressing the malnutrition burden, our investments need to happen at the right time. That is the first 1,000 days of life. That is starting from conception throughout pregnancy, birth, the first 2 years of life. Dr. Venkatesh, you can click to add the next, yes, the next one, yes. So when you are investing in this time frame, it is acknowledged based on evidence that you are actually undertaking or doing most cost-effective intervention to ensure human development, for reduction of intergenerational poverty, and not just improving the health outcomes across the generations. So it brings to you a lens even beyond health when we are talking of human development in terms of economic development and addressing intergenerational poverty as well. And so this first 1,000 days of life remains a critical window of opportunity whereby we are ensuring optimal growth, development, child survival, and lifelong health and nutrition. And we must also understand that this investment, this critical period when we are investing in the nutrition of the child right at the beginning of the child's life, it plays a major role in determining the cognitive development. And we are ensuring the quality of the human capital that is being created in the society, because it would affect adult life productivity. So if we are considering how important nutrition investment is, and particularly in the first 1,000 days, when we are looking at maternal, infant, and young child nutrition related investments, we must understand that we need to be updated in our knowledge and skills, because we have a very important role to play as healthcare providers across the sectors, across the disciplines. We may be in the academia, we may be in the service delivery, we may be in the public health system, we may be in the private health sector, we may be community health professional, we can be pediatrician, we can be an obstetrician, we can be a public health professional, a nutritionist, or even a social worker in the public health domain. So the next slide. As I said, today I will be focusing more on breastfeeding and also to some extent on complementary feeding, considering the time that we have. I'm not going into maternal nutrition today because it would have required more time. But of course, when you talk about breastfeeding and complementary feeding, you cannot do away with maternal nutrition and maternal health, because the mother and the infant, they are so closely interconnected that there will be overlaps as I speak. And I would start with re-emphasizing about the benefits of breastfeeding, which I think all of us know. We had an excellent evidence-based series from Lancet in 2016, when it was clearly stated that scaling up breastfeeding to a near universal level would be saving lives of over 8 lakh under 5 children annually in the 75 high mortality countries. And it would also save additional 20,000 maternal lives annually from breast cancer. At the same time, it will prevent 54% of diarrheal episodes and 32% of respiratory infections. And this definitely reduces the health expenditure for government as well as families. And if you look at early initiation of breastfeeding separately, it can prevent a quarter of the newborn deaths. And the earlier we initiate, the better the results, compared to infants who are initiated within the first hour of life. When infants get initiated between 2 to 23 hours after birth, they have a 33% better risk of neonatal mortality. And while talking about the mortality and morbidity related issues, I will bring the economic lens. Because if you are investing $1 in breastfeeding promoting interventions, you will get a very high return of $35 US. And this economic discourse is important. Let's move to the next slide. Have we really progressed? Progress has been made, but still globally, we have not reached the 50% benchmark where you have half of your infants being exclusively breastfed. This was a World Health Assembly target. We are yet to reach that point. In South Asia, we are doing better than the global scenario, but we still have 40% of our infants in South Asia not yet exclusively breastfed. And India, though we have a exclusive breastfeeding rate of 64% as per the latest National Family Health Survey report, we are still leaving behind 1/3 of our infants. And in Bihar, we are still having 2 out of 5 infants who are being missed out. And there is also a huge missed opportunity with early initiation of breastfeeding. In the low and middle income countries, we still have half of the children who are not receiving early initiation of breastfeeding. And in South Asia, it's only 2 in 5 newborns who are being put to breast in the first hour of life. India has a similar level with early initiation of breastfeeding. In Bihar, we are not doing very well. And I've been talking about the Bihar statistics because I had thought we would have an audience mostly from Bihar, but I understand it's pan-India. But in Bihar, we also see that only 1 in 3 newborn are breastfed in the first 1 year of life. And worldwide, we are seeing that prelactials, when they are given, they have a strong association of delaying initiation of breastfeeding, shorter duration of breastfeeding, and there is an increased chance of consumption or feeding of formula milk. Why am I bringing in the formula milk? You will understand in my next few slides. But let me talk to you a bit about cost of not breastfeeding, which is based on global research by Alive and Thrive, along with Nutrition International. The next slide. Let us quantify what it means when we are not adequately breastfeeding. That is, we are not following the WHO recommendations of breastfeeding, like early initiation of breastfeeding, exclusive breastfeeding for 6 months, and then continued breastfeeding for 2 years and beyond. We have a huge economic cost that we are paying every day. There is a loss of US dollar 1.5 billion that is happening every day. And if we are protecting, promoting, and supporting optimal breastfeeding, it has the potential to prevent global economic loss worth USD 574 billion per annum. And if you break it up, you can see the numbers are huge. Dr. Professor C.M. Singh spoke about the growing burden of overweight and obesity. You will prevent 4.58 million cases of childhood obesity per year. You will avert over 4 lakh childhood deaths from pneumonia and diarrhea, and almost 1 lakh maternal deaths from breast and ovarian cancer. There are huge health system costs being saved when you are protecting, promoting, and supporting breastfeeding. 18 billion USD getting lost due to child mortality, 2 billion due to maternal mortality, and the treatment costs 23 billion. And the amount of cognitive loss, 200 million IQ points lost per year, and a whooping amount of USD 530 billion in potential future income loss due to the cognitive losses we are incurring because of not breastfeeding our next generation. And of course, there is a huge cost on the families who spend on formula. So the next slide, please. So South Asia also incurs a huge cost, annually 21 billion, and India pays a price of over 15 billion USD every year by not adequately protecting, promoting, and supporting breastfeeding. So the next slide. So let us come to the Lancet 2023 series. It links us to the evidence that Lancet 2016 series had provided. It links us to the economic costs which have been quantified through research if we are not breastfeeding. But this series brings us to a topic that we discuss much less as healthcare professionals, whether in the clinics or in the public health. We do not talk about adequately protecting breastfeeding. And that's why, the marketing of commercial formula is showing exponential rise over the past few decades, and it is altering or creating havoc in the infant and young child feeding ecosystem. The next slide. And this series clearly sends out certain messages to us that if we really want to make breastfeeding a success, it has to be a multifaceted policy and societal response. It's not the responsibility of the mother alone. And we must remember how the marketing is happening. You know, normal infant behaviors are being misinterpreted and reframed. The normal is being reframed as abnormal by the very powerful commercial milk formula industry, and they are promoting artificial solutions, and they are influencing our beliefs, values, and practices. And we are not realizing the extent to which they are influencing. And, you know, all the evidence, including, you know, work that Alive and Thrive has done globally and other partners, WHO, UNICEF, that they have been doing globally, it shows how the industry also tries to engage with us who are in the healthcare professional to influence the decisions that the parents are making. And we have a very critical role to ensure that we provide the accurate, evidence-based information and support to the families at the community level and design our programmatic and policy actions accordingly. And there are many structural factors which really need to be addressed in a collective manner by the government, by the health system, the civil society organizations, by society at large to bring about this change. The next slide. And this is a conceptual framework which shows, you know, the broader structural determinants which influence breastfeeding and how the marketing comes in and the political economy of the commercial milk formula. We have to look at the diverse settings in which this ecosystem of optimal breastfeeding is centered. We are here, the health system, providing the right kind of services, including counseling. There is the family and community ecosystem. There is the workplace and the employment, you know, landscape. And, you know, we must understand what are the issues where we need to act. You know, what is the challenge that a new mother faces or a mother faces, the family faces? How is her belief, her self-efficacy getting influenced? And what are we doing? Are we providing the right information, right counseling? And it's not just limited to services. We must understand the legislation. We might think, you know, that we are doctors, we are nurses, we are public health professionals, nutritionists. What is our role in the scope of the legal measures? But how does health policy relate to the legislative framework? But, you know, we have to bring all that together. There has to be the right kind of financing, right kind of political will, commitment, along with the right kind of health system responses. I know when we were starting work with the medical colleges years back, including with AIIMS Patna, the next slide, when we were looking at the undergraduate curriculum, you know, and we were talking to students with faculty trying to understand where are the key gaps when we are talking about IYCF. We know about the importance of breastfeeding, definitely. But how much were we aware of the international code on breast milk substitutes or our infant milk substitute or IMS Act in India? Was it important to the medical students? No, it was not, but it has to be. So the next slide, please. Because otherwise, we will not be able to counter the marketing, which is a system which is multifaceted, sophisticated, very agile, well-resourced. It is self-enforcing. It is using the latest technology, and it is trying to capture the parents, communities, yes, science and policy. And it is trying to shape societal and professional norms, values and beliefs to alter the decisions. You will see that we health professionals, I had understood that we have a majority of people who are health professionals in this audience. They engage with us in various ways, in subtle ways. I belong to this profession only. So I know how this profession leads to counter the negative influences, but I also know that we are vulnerable. We are often not fully aware to counter this very multifaceted, sophisticated, and skillful marketing that is happening. The next slide. And which has resulted, that the sales has reached over 55 US billion in 2019. And, they spend a whole lot of the revenue generated on marketing. The next slide. And as I said before, they reframe normal infant behaviors like crying, fussy behavior, short sleep duration as something wrong, pathological. And they will sell that our product is going to provide solution. Your child will sleep better. They sell sleep, as they say. They work on the parents' vulnerabilities, as was evident during COVID. They work on parents' aspirations. And we must understand that self-reported insufficient milk, which many of us here in the audience and amongst us, we know is one of the leading causes why exclusive breastfeeding gets disrupted. And this happens because we misread, misunderstand infant feeding cues. And the mother isn't adequately supported, counseled to understand that this is perceived insufficiency. She has enough breast milk to feed her newborn. And that is where the marketing comes into play. And the international code or the code in the countries, they get manipulated, circumvented by the industry. And yes, the way we support women, there is a gender dimension. How many of our women get the right kind of maternity leave or the support at workplace for breastfeeding? And that's also taken advantage of by the industry. Breastfeeding is not anti-woman, but our policies, we are not using the gender lens to understand the challenges of the woman, the working woman particularly in the informal sector. So the next slide, and we must remember that the challenges are there even within our health system. When I had begun my career, and I was working for the Baby Friendly Hospital Initiative assessments, I remember my colleagues in the nursing professional, I do, they had asked me that, ma'am, if we ourselves being in the same ecosystem, the doctors, the nurses, we are not able to breastfeed our children exclusively because of coming back to work. We are in night shifts. How do we really ensure the baby-friendly hospital initiative steps being implemented in our facilities there? So these were genuine challenges that I had learned 25 years back, and they do persist. So, they have, the key message is that it has to be a collective action of all of us coming together. And as health systems, we must deliver women-centered care, starting from the antenatal period, birth, and in the postnatal period. And the health workforce has to be empowered to support the women, the families, the communities, as well as to counter the negative influences. And this has to be backed by the right kind of policy level strategies across sectors. And we must value the gender dimension, the value of care work, maternity protection. These are not disconnected pieces of, policy or programmatic action. Whether we are in health, whether we are in social protection, whether we are in women's empowerment, whether we are in the financing, or it is the commercial milk formula or the food, which is influencing the food, the health systems, the entire health, gender, economy, and political, ecosystem around this. So let me move to the next slide. I think we are running quite short of time. So the next slide, please.
Yes, ma'am. Just a
So
second.
that's the key message of coming together and understanding the importance of protecting breastfeeding. And there is another neglected aspect, that is the diets, complementary feeding. And we have recent definition coming out, which is very hard-hitting, about child food poverty. So we talk about a child getting a minimum diet diversity being accomplished in their diet when we are giving them 5 or more food groups out of 8 defined food groups. And it includes breast milk. I'm talking about the young children. We cannot ignore the first food system. But, we are seeing children experiencing food poverty. And how are we defining food poverty? It is of moderate degree when they receive only 3 to 4 food groups per day out of those 8. And when they just receive 0 to 2, it is severe food poverty. And we have in South Asia, actually, half of the children who are suffering food poverty actually experiencing severe food poverty. And we know the scenario in India and in Bihar. 1 in 10 children, 6 to 23 months, they get an adequate diet. So I'm just giving a very high level kind of just like the tip of the iceberg kind of a message. But look at, the entire continuum starting from breastfeeding to child diets and feeding in the first 2 years. It's an issue of child food poverty. So I'll stop here and I'll talk about this e-learning course, which is on maternal, infant, young child, and adolescent nutrition. which was developed by and is hosted at the Indian Institute of Public Health, New Delhi. And it was developed jointly by IIPH Delhi with Alive and Thrive and miycan initiative, but with inputs from key professional medical associations like IIP, FOXI, IIPSM, ISOPA, and experts at the national level, including senior faculty from AIIMS Patna. We had, validation inputs coming in from Ministry of Health and Family Welfare. Nutrition International was an important partner in this course. And we have FOXI's Indian College of Gynecology providing credit points to this course. And this is a course which aims to sensitize, update medical practitioners, public health, and nursing professionals, including, final year students, postgraduate trainees, on the latest evidence in maternal, infant, and young child nutrition and adolescent nutrition, and gives them, a better understanding of all the global policy guidelines and national guidelines. So the next slide. So there are different modules in this course. We have the core content being provided along with links for additional or advanced learning. So there is an overview module on why first 1,000 days, followed by importance of preconception, nutrition care, and maternal nutrition care. And maternal nutrition includes both nutrition care during pregnancy and in the postpartum period. Then we have the infant and young child nutrition, then nutrition during adolescence. And these modules all focus on the preventive and promotive aspect, which complements our clinical learning. And there is a special focus on counseling. This is something which we often tend to miss out. And also it gives you an overview of how our public health systems delivers nutrition services and what are the various programs that India has under the Ministry of Health and Family Welfare or the State Department of Health and Family Welfare, and under Women and Child Development, that is the Integrated Child Development Services System. So it prepares you or primes us to understand the entire public health and nutrition ecosystem, what is happening through the systems, what are we delivering, what are the current programmatic actions through Government of India and governments. And this is an online course. You can do it at your own pace. It sort of gives you a comprehensive idea, and you have computer-based sessions. You have recommended readings, links for advanced studies. There are virtual lectures. There are assessments. And this is all through the Indian Institute of Public Health, that is part of the PHFI's different institutional mechanism. It's on their web-based platform. And I think it speaks about, enhancing knowledge of medical practitioners across the streams, whether allopathic or Ayush, and, the public health professionals, nursing professionals. And I think I've already mentioned that you get an overview of global and national policy and programmatic guidance. You understand the delivery mechanisms, and you have a we are trying to build a harmonized understanding, and what kind of messages go out through the public health nutrition community to the families, because sometimes we do contradict each other. So the next slide. We thank you for your patient hearing and open to take questions. Thank you.
Thank you so much, ma'am, for such clear explanations and engaging delivery. Hope this would have been an academic feast for all our participants. So next we'll have this question and answer session. Audience may start typing their questions in the chat box. I request Navina Swapnab ma'am from Alive and Thrive to take over the Q&A session.
Thank you, Dr. Venkatesh. Hi, I'm Novina Swapna from Alive and Thrive, the Communications and Advocacy Specialist with the team. And I'm sorry to say I'm not a medico. I see a doctor written before my name, but I'm very, very privileged to be on the panel today. And thank you, Dr. Shivanti, for such an engaging and a very comprehensive presentation. So just to start with, I have seen a question in the chat box from Ankita. She wants to know if there is any specific criteria to declare, say, a young child or infant malnutrition, undernutrition, or adolescent undernutrition. So it's a very, very broad-based question, I understand, but over to you, Dr. Shivanti. Is there any specific criteria?
If I am getting the question right, I think we have clear-cut definitions of, yes, we have the anthropometric assessments based on which we define undernutrition, like we have stunting, we have wasting, we have underweight. We have the body mass index to, assess, whether a person is underweight, severely underweight, or overweight or obese. So these criteria are well defined and they are globally defined, as well as there are cutoff which suit the country or the region specific population. Like when we are talking about BMI cutoffs for Asian population or for the Indian population, we have defined criteria compared to the global or the American or the European criteria that is being used. And of course, like when we talk about young children, as I said, it's all well-defined criteria using growth charts on how do you identify a child underweight or a child becoming stunted, which is indication of chronic undernutrition, or there is acute undernutrition and you are having wasting. So you go by the criteria of weight and height or length depending on the age. So those are details which can definitely be later on shared, but I don't know whether I have so much time to explain all that, but criteria exists.
Thank you. The other question we have, Dr. Rajat. He would like to know, do we have any dietary assessment tool for undergraduate medical students use? And usually we use 24-hour recall techniques to assess.
Yes, you are very right. You have the 24-hour dietary recall tool, but recently a lot of work is happening around, doing better measurement of diets across the various population group, because what we are eating, and particularly like what are we giving our young children, or what is a pregnant woman or a lactating mother eating, we really do not have data which is coming in on a regular basis. Your NFHS provides you with certain ideas and they provide you, about the different food groups that were consumed in the last 1 week. There is a new global dietary quality score metrics that has been developed with Harvard and Alive and Thrive global team. It's our colleague team at, it's the intake team, sister initiative of Alive and Thrive, which is trying to develop easier metrics for measuring diet and assessing its quality. But yes, we also have, these cutoff definitions on minimum dietary diversity for women in the reproductive age group, for young children. I just referred to the minimum diet diversity, which we use for diets of young children in the complementary feeding scenario. There has been a recent change. Earlier, we used to look at 7 food groups and not include breast milk. Now, WHO UNICEF has changed that definition to 8 food groups, including the breast milk, and looking at, how many food groups. 5 is the minimum cutoff for achieving minimum diet diversity for a young child. So there are details that can be further shared.
Yes, ma'am. Thank you. Thank you on that note. But we can take another, I think, 1 or 2 more questions. But we have a question from Dr. Shweta. She wants to know, do you have any tool to do dietary assessment in adolescents besides the 24-hour recall?
This global diet quality score covers, different age groups in the population and applies to adolescents as well. So this is still work in progress, and I do not know. We can share it with AIIMS Patna, and how we can disseminate it further. We can have that discussion with AIIMS Patna. So there is work now currently ongoing to expand the way we can, do better assessments of diets. This is an important and missing link in our current
programming,
system.
Yes. There is someone who wanted to know if there is a course fee for the miycan e-learning course. That's Ankita, I guess. Yeah.
Yes, this course that I spoke about does have a fee element. It is, I think, Navina, you can come in and talk about the course fees, which is charged, of course, by the Indian Institute of Public Health, Delhi, part of the PHFI institutional group.
Yes, they're charging a nominal fee of 2,000 rupees. It's a 4 months duration course. But however, if it's a bulk sort of a booking, we can always talk to IPH Delhi on the course fee. And that discussion we can definitely take offline. Anyone who wants to know more about the course, please feel free to get in touch with me through Anupam Srivastav. I am happy to take all your queries regarding the course. I think we're running out of time. Dr. Venkatesh, how do you want to, should we, yeah.
Yes, ma'am. Thank you, ma'am. Thank you for taking the questions. Thank you, Sevanthi ma'am, Dr. Navina ma'am. So now I request Praveen Sharma ma'am from Alive and Thrive to share the closing remarks.
Okay. Hi, good evening. I'm Praveen. No problem. So thank you. First of all, thank you very much, AIIMS team, for organizing a wonderful session. And as we know, AIIMS is always a pioneer to do the partnership with the various institutions, development partners, and pioneer, of course, in miycan also, and not only miycan, practicing the miycan in the AIIMS Patna Institute itself, will pioneer to help the other institutions also. Even this session is an example why they are pioneer, because primarily the session was meant to orient on this course also only. So we have been requested, I mean, Alive and Thrive has been requested to conduct a session. So Dr. Sevanthi has shared the miycan, especially breastfeeding practices and learnings in this course. And, you know, this is an example how I mean, they are advancing the miycan and the nutrition practices and wanted to share with others also. So yes, thank you very much, Dr. C.M. Singh, Dr. Pragya, Dr. Venkatesh for organizing this session, and other, of course, the other team members and faculty members from AIIMS Patna. So yeah, I wanted to conclude, like, this is a, I mean, especially this course organized by IIPH have been developed by various experts engaged from various sectors like academia, development partners, and those are working for the the government sector also. And it took a lot of time to develop this course. So and so that the participants can learn the miycan very quickly, and it is not long course, it's just 4-month course, and please enroll and get the benefit of this course. So I wanted to thank you again for everyone for organizing this. Also, let me say I am Praveen Sharma. I work with the Live Tribe. Yeah. So over to you, Dr. Venkatesh.
Thank you, sir. Now I request Dr. Ahmed, sir, Associate Professor at the Department of Community and Family Medicine, AIIMS Patna, to kindly share the order. Ankita, can you please mute yourself?
Yes, thank you. Thank you for everyone.
Kindly mute yourself, Ankita.
Okay.
Over to Samshad, sir, please.
Thank you, Venkatesh. Good evening to all. And because now we are ending the session, and we have, in fact, we have known that learning experience have become extremely simple in recent years. And after COVID, what happened that we have seen that it has opened up many new learning opportunities. And along with online webinars, workshop, we have various e-learning courses available on various platforms. And these are one of the best learning options available right now for students, for learners, for all kinds of learners. And in this context, the Public Health Foundation of India has launched its e-course on maternal, infant, young child, and adolescent. Right now, recently they have added nutrition. And we think that it will definitely be helpful for all the students, residents, PhD students, and all students who are working in the field of nutrition. And we believe that this brief on orientation session that is conducted very well by Dr. Sevanti Ghosh and coordinated by Dr. Novina. And through this session, it will be useful for us in making your decision to whether to enroll in this course in future. And we definitely suggest that you should enroll in this course in future, because this course has a credit points and it's very minimal, on very minimal price. So definitely try to enroll in this course. And again, I would like to express my thanks to Dr. Sevanti ma'am and Dr. Navina for sharing their knowledge and experiences on their subject. And we were definitely, your talks were very educational and insightful. And finally, I would like to express my thanks to Anupam from Alive & Thrive, Venkatesh and Athira from AIIMS Patna, Sonanki, Prachi, and Develina, and all others team members of Coronet for their assistance and coordination of webinar events. Wish you all a good learning ahead. Thank you, Venkatesh.
Thanks a lot, sir. So once again, I thank all our faculty members, Shabanti ma'am, Navina ma'am, Praveen Sharma sir, Shamshad sir, Pragya ma'am, Team Planet, and all our wonderful 2000 plus participants for making this event a grand success. E-certificates for this session will be shared on your registered email ID within 10 days. The recording of this session will be available after a week's time in our department YouTube channel, Merit India, MERIT India, Merit India channel. Thank you so much, everyone. We are closing now.
Thank you.
Thank you so much. Thank you so much.
Thank you, Dr. Venkatesh. Thank you so much. Thank you, Dr. Samshad.
Thank you everyone for sharing their valuable insights. We are more than grateful to everyone present here. We hope to have you again on our platform very soon. With all your permission, we are closing the room. Thank you.
Thank you. Thank you so much.